Hello everyone, this is Dr. Joshua Crose with Capitis Medical and Aesthetics. I'm on vacation right now up in the mountains, and I just wanted to briefly throw a couple pieces of information that a number of my patients have actually asked me more recently. And this is regarding semiglutide and tirzepatide, or Ozempic and Mounjaro, that is commonly used for weight loss. And a lot of my patients actually reach a plateau and they'll ask, should I take more of this? I'm not losing more weight. And the first thing I inevitably ask them is, well, are you hungry? Is it suppressing your appetite for the full week? And invariably they say, yes, I'm not eating any more than I did when I first started, but I'm just not losing the weight anymore. And then I tell them, you know what, don't take any more than you're taking now because you've reached a plateau, and this has more to do with innate metabolism, which is very complex. Invariably, when you go through a fasting state, especially with the assistance of either Mounjaro or Ozempic or semiglutide or tirzepatide, you are losing more muscle relative to fat, and this is known and documented. So you actually are becoming skinny fat, actually. So you lose weight and you look good, and it helps a lot of other metabolic aspects, including decreasing inflammation. But eventually you'll reach a plateau where you are actually no longer getting healthier, but are actually getting less healthy. And that's because you need muscle. Muscle is the cornerstone to metabolism and health. And you've reached a point where that muscle level is too low, and you really need to start focusing on this. This is why I always coach my patients when they're going through weight loss and using these agents to exercise. You must do resistance training, and you also must eat protein. This is crucial to maintain as much muscle as possible, because muscle is what drives your metabolism. Additionally, when you're fasting, you also go through a problem with your thyroid function. Now, I know there's some publications bringing this up into question, whether you really have any thyroid issues or not, but ultimately you do get problems with your thyroid, because even with a 48-hour fast, and this is documented with a number of publications, your free thyroid, your free T3, which is the actual active component, actually drops. And so if your free T3 goes down, then your metabolism goes down. And this is an adaptation by your body to slow the metabolism down, because it senses there's not enough calories coming in. Our body is extremely smart at adapting to its environment. And if it senses that there's not enough calories coming in, it will slow your metabolism down eventually, so that it can keep you alive. That's just part of the evolution of humans. At this point, I usually tell my patients that we need to change the way that we're actually trying to get you to lose weight. We need to go into an increased metabolic functional profile, where we actually increase the amount of food you're eating with small meals multiple times a day. There's also some other agents that we can give you to help you, including peptides. But ultimately, we have to switch things up, because starving does not work indefinitely. You will actually need to eat, and you will actually need to bring yourself back to health, because your thyroid, your metabolism, your fat muscle ratio, everything will get thrown off the longer you stay on these medications. I hope this has been of assistance to some people with this specific question. Once again, this is Dr. Joshua Crose with Capitis Medical and Aesthetics. I'm always available for virtual consultation or in-person consultations if you have more specific questions. I also do significant work with genetic profiling and catering treatments to my patients based on their specific needs. I hope you have a wonderful day, and take care.